Awesome. Welcome, everybody, to the next in our Functional Wellness Community Forum. This is Complete Wellness's effort to serve the community even better. It's our way to reach out to the community who are not patients, who need our help, but are not coming into the office yet, or for whatever reason. You don't live in the neighborhood, you live cross country, and you'd like to learn more about functional wellness. We're happy to have you. So this is number 7.
Sounds right.
I think so. But this is specifically number 3 on the gut. And we're going to pick that up in just a minute. But before we do, let's talk about what functional wellness even means. Functional wellness, functional medicine, it is thus named because we want your body to function as best as possible. We want you functioning at a high level, not just at an okay level, or in a way that traditional medicine treats you. You have to wait till you get sick to get attention and love and TLC and care. That's not how we operate. The way we operate is we want to get you functioning as best as possible. And functional wellness is about all things lifestyle. Food, obviously, nutrition, vitamins, supplements, sleep. Diana, what else?
Energy, libido, mood, happiness, mental health.
Yeah, those things. So that was Diana, who is our functional wellness registered dietitian nutritionist. 5-word title. That's cool. And she is our lifestyle guru at Complete Wellness. So we've been talking about the gut. We've been talking about functional wellness for a few more weeks. We've been talking about the gut for 3 weeks because the gut is really, really, really important in health and wellness. I'm just going to recap very briefly some of the things that I think are important that we spoke about in the previous weeks, which is, what is the gut? The gut is your small intestine and your large intestine together. So that means the gut begins where your stomach ends and ends where your tush ends when you go to the bathroom, when you detoxify. That's the anatomical part. And it is where we digest our food. It is where we break down our food. It is where we absorb our nutrients. And one of the big things we spoke about last week and even into the week before was the need for bacteria. Right? You've heard that about the microbiome and all of that. We need certain bacteria in order to digest the food in a proper way. So that's why we take probiotics, which replenishes the bacteria, or prebiotics, which helps the bacteria to grow in the gut. And then we started to go into a very big topic called leaky gut. Leaky gut is a really complex issue, and I was really thinking about it today. And I remember in a nutrition lecture when I was in school back in the early 80s talking about the gut, and that was 40 years ago. And it's interesting that from a medical point of view, leaky gut is still considered experimental or questionable or unproven, or I don't know.
It's on its way.
It's on its way. It's been on its way for 40 years. So let's dive into what leaky gut is And Diana, if you could explain exactly what it is with that great little analogy that you did last week, I think that was really great.
Yeah, so essentially we have tight junctions of our gut that are very tightly wound together, very much like my fingers are right now. Essentially,
all right, so I'm going to ask the stupid questions. What does that mean, junctions? Junctions of what?
That connect cells together, right? So our gut lining is one cell thick, which is like you'd think it's more than just one cell. It's one cell thick, but they're all connected together by these tight junctions that tie all the cells together. And so they're tight.
The lining of the gut.
Mm-hmm.
And that's both in the small intestine and large intestine?
Leaky gut is mostly talking about the small intestine.
Got it. So the small intestine lining is one cell thick, and those cells are connected by junctions.
Exactly. And they are called tight junctions because they're supposed to be tightly wound together. And the whole point of them is to keep large items that shouldn't be there from passing into the bloodstream. So if you think of it like a cheesecloth, barely anything can get through, right? If I put sand in my hands right now, like maybe a few morsels would kind of pour through, but really, like if I also put rocks, they would stay.
Can I give you a 1 second timeout? I have to straighten out my ear situation.
Yeah,
I think I'm supposed to. I have earbuds on, and I think they're supposed to be in my laptop and not on my phone, which is where Insta is.
Oh, go ahead.
Is that right? I hope that's right. Did that get rid of the echo? Diana, speak for 1 second.
Hi. Are we echoing?
I don't know. Somebody will tell us. Okay, keep going. I'm sorry. So the cells are tied together in these junctions, and
actually
maybe
I
it's
hear
you.
the echo now. I think it's just because we have both of these open.
Can our tech help come on, Ben, and tell us what to do? If someone could write in the chat if this is better, if the echo is gone.
Oh, it's better? Okay, great.
Good. So let's continue.
Okay, so think of it like a cheesecloth. Barely anything can get through. And so this is really how the gut should function today. Only allowing very small essential particles like ions and water and nutrients to get through. So when there's inflammation in the body, whether it be from a food, a pathogen, something that shouldn't be there, a protein in the gut responsible for keeping these tight junctions together. Okay, I'm making sure that echoes gone.
They said the echo is gone. So
okay, good. I'm echoing myself, but that's okay. I can ignore it. So this protein that's responsible for keeping these tight junctions very much intact is called zonulin. It goes on to these tight junctions and knocks and opens them up. So what essentially happens is that the cheesecloth goes from looking like this to like this. And it's more of like a netting, a netting with like lots of big holes, like almost like a basketball hoop net. It can get pretty large, right?
Sure.
Larger particles.
Stretched out.
Exactly. So larger particles enter the bloodstream, like toxins, bacteria, or even like food particles that shouldn't be there. And so this is exactly what intestinal permeability does. And so our body starts tagging all of these proteins or all of these bacteria that are coming into our blood and saying, wait, these shouldn't be here. And it creates an immune response. And that's how leaky gut actually becomes more systemic. And it's why people
the body's response to the leaky gut where it becomes a big problem.
Exactly. And what also happens is people start to notice that they have increased amount of food sensitivities. So it's like all of a sudden they just start reacting to all these different foods, and it's often foods they're eating a lot of, because instead of just the nutrients leaking through that cheese broth, they're also leaking through, now these huge proteins are leaking through those big nets, and your body is flagging all of these food items and saying these shouldn't be here. And so you start to have reactions to all these various foods.
Okay, I need clarification on something. Remember, I'm asking the stupid questions. The thing that opens up the junctions is the zonulin
Protein, yep.
protein. Where does that come from?
It's in the gut, but what happens is there's different triggers for it. So it could be a food intolerance, it could be inflammation, it could be a specific pathogen like food poisoning. Some people get food poisoning and never feel the same. And it literally communicates to zonulin to go to the gut lining.
And where should it be?
Somewhere else in the gut, not over there opening, causing havoc.
Okay. Got it. So
it really shouldn't be much at all, right? So we measure that protein. We measure that protein, and if it gets above a certain level, that's when we get concerned.
So it multiplies the zonulin in that bad scenario.
Yes.
And when it multiplies, it goes towards the junctions and opens them up.
Exactly.
Okay, good. So what are the common symptoms that people get from leaky gut syndrome? And I want you to divide it out into the most common local symptoms, meaning digestive, there in the gut, and then those systemic things that you see often.
So local, and this is usually where it begins, is abdominal pain, bloating, gas, diarrhea, bloating, constipation, just feeling like you can't really eat many things.
Because you react to them.
Exactly.
Sounds terrible.
It's not great.
And then those local symptoms, diarrhea, constipation, bloating, pain, often, unless it's treated, if it goes untreated, they can progress to systemic problems like
depression, joint pain, acne, rashes, eczema, psoriasis, skin issues. Those are kind of the main ones.
Depression. Is that a common side effect?
Depression, anxiety, yeah.
Depression, anxiety, is that a common side effect from?
Yes, for a few reasons. One is you're not able to absorb and digest a lot of the foods that you're eating. So you need a lot of nutrients, right? You need specific amino acids to upregulate serotonin, for example, to upregulate each of the neurotransmitters in the gut. And so if we're not absorbing our nutrients, if we're not absorbing our proteins, it's very hard to then get the necessary precursors to these neurotransmitters. Then the other part of this is that a lot of these neurotransmitters are actually produced in the gut. So if there's anything off in the gut, it's very common that depression and anxiety are a side effect. And we see people come in all the time who are like, they list all the problems of what's wrong with them, digestion-wise, skin-wise, you name it, but then it comes up later that they also have some anxiety, or they feel like they've been dealing with more depression. And I'm always kind of trying to explain this connection, because there is a huge connection. And we find that when people start to get their gut health in check, they often feel a lot better.
So I'm going to ask a really dumb question. If someone has anxiety and depression, they should come see you first?
Depends. It depends how bad it is, right? If it's actually very serious and you need to be medicated, then by all means, right? But at the same time, if it's just starting, then yeah, you should definitely look into your gut health. You should also look into your nutrient status, right? Because you might just not be getting enough of certain nutrients. But I would do this at least simultaneously, if not early.
Are there psychologists, psychiatrists out there who know this about leaky gut and work in that way?
Not that I'm aware of, but if anybody finds one, please let me know. But
Wow, 0?
there might be. I don't know everybody, but
No, of course, but you.
not that I'm aware of. There
Wow.
are more, dermatologists are starting to look more into this, right? Into terms of skin issues. They're now testing for Sibo when there's acne or whatever's going on, which is good. But I haven't seen psychiatrists looking into this yet. What I have seen is that they'll use some of those amino acid precursors I was talking about to upregulate those neurotransmitters, which is a step in the right direction.
But it's not a complete answer if they don't heal the leaky gut. It's a step in the right direction, but it's not really an answer.
Right. And we'll use those amino acids too in the meantime to keep you sane, because you don't heal the gut in one day.
True that. So how do you test for leaky gut? Someone comes to you, they have anxiety, they have depression, they have skin issues, sort of the triad or one of the triads of leaky gut. How do you test? How do you find out whether or not that's a contributing factor to their issues?
So you want to do a few things. One is you want to get blood work to figure out, is there malabsorption?
So, I'm sorry, just interrupt.
Yeah.
I went to my regular doctor and he did blood work and everything's fine.
Wow, it's like you are inside the head of all of our patients. Yes, that's very common, except what did they test for, right? How many vials of blood did you get? Usually it's like 1 or 2. Whereas we are looking at so much more, right? We're looking at your nutrient status. We're looking at inflammation. We're looking at even autoimmune markers. We're looking at hormones. We're looking at so much more. And so I'll always say, I'll take what I can get, right? Let's get started with what you have in the meantime, and then we'll order in more, to get started. But usually there's so much more. And if you're questioning, what should you ask your doctor, you can reach out to us, but you probably need to bring in more to get tested.
You could also ask us in chats, wherever you are. You can post a question. And perhaps, we can answer it. Obviously, we don't get too personal, but general questions for sure we can answer. So back to the blood work. So is it blood work that will reveal leaky gut?
So leaky gut it's like glorified, right? There's no 100% definitive marker. Yes, we can test for zonulin, but I've seen leaky gut where zonulin is not super lab high. It's more figuring out what's happening in the gut, what are the triggers and what are the causes of leaky gut. People come in all the time and they're like, I think I have leaky gut, and it's like, great, but what's causing the leaky gut, right? If we know your gut's leaky, I'm not just going to give you everything to close the lining. I'm going to figure out why it's open in the first place.
What's causing it is the zonulin.
But what's causing the zonulin to go to the gut lining, right? Something.
Got it. Okay.
So blood work, we'll look at, white blood cell, and then there's some basic things like white blood cells can indicate an infection. High eosinophils can actually indicate a food allergy or a parasite. We look a little deeper than, and then also we might consider doing a breath test if we think you have symptoms of Sibo, which tests for various hydrogen or methane gases.
What is Sibo?
Small intestinal bacterial overgrowth, where bacteria from the large intestine goes into the small intestine where it shouldn't be.
Wait, I thought we're supposed to have bacteria.
But not too much. You want a lot in the colon.
Just enough, but not too much.
Yeah.
Okay.
And then the last item we might consider, there is an intestinal permeability test, which just measures 2 various sugar molecules that shouldn't get through the gut lining. And if they do, you have leaky gut. But again, that doesn't tell us that much because it doesn't tell us why it's happening in the first place. So my favorite thing is to do a GI map or a diagnostic stool test that goes beyond just looking for like Salmonella, E. coli, Shigella, like the typical things you might pick up at a restaurant, unfortunately. But we look into digestion, absorption, microbiome diversity and abundance, immune function, digestive enzyme activity, parasites, opportunistic bacteria, food sensitivities, you name it. We look at all of it in this test, and that really helps us get to the bottom of it.
This sounds complex.
It is, but that's how we do it for you.
The figuring it out. Gotcha. So what are the things that have to show up positive for you to say, this person has leaky gut?
So one is symptoms, right? The symptoms we outlined, having a few or some of them, which name a person who doesn't. Actually, I've seen a few, but a lot of people do. And then the second thing is either an overgrowth of opportunistic bacteria that shouldn't be there, looking at parasites, right, that they shouldn't be there, looking even at like if a person has increasing amounts of food sensitivities, they're not able to like really tolerate or break down the foods. And then also one thing people don't always consider is just not having enough good bacteria in the gut, which in itself can cause issues.
Got it.
And then yeast overgrowth too.
Got it. So I've been asking all the questions. If there are questions out there in social media land, feel free to post those questions. And if we can, we'll answer them. We are at 21 minutes after our start. We're going to go for about another. Have you had patients with tinnitus from leaky gut? If so, have you experienced tinnitus being resolved once gut is healed, once the gut is healed? Yes. Tinnitus, for those that know, is ringing in the ears.
Yes, it could be from leaky gut. It could also be from poor mitochondrial function. I'd also ask you if you had COVID because it's been a post-COVID symptom. But those are a few things we'd look into depending on your symptoms beyond the tinnitus too.
Remember that I'm the clinical director at Complete Wellness, but I'm also trained as a chiropractor. And I would also look at the upper cervical region of someone's spine, very often related to tinnitus or tinnitus, depending upon what part of the country you're from and how you want to pronounce it. Tinnitus or tinnitus. The other question is, how do you treat Sibo, small intestine bacterial overgrowth? Too much bacteria.
Yeah, so we will use antimicrobials, which are herbs that exist in nature, like oregano, berberine. Those are kind of like the two big hitters, but there's a ton of them that we'll use in different blends. We also will support symptoms, right? So if someone's having like severe acid reflux or severe constipation, we want to support motility, make sure that everything's moving. I think I just paused. Yeah, everything's moving through the gut as it should, especially if you have methane overgrowth, which is a type of Sibo that causes more constipation. Or if you have more hydrogen, you might have like more acid reflux, more burping, and we'll kind of manage that as well, both with diet changes and herbs.
Very good.
And if somebody's already on Xifaxan or rifaximin, which are two really common drugs used in tandem to treat Sibo, we support them through that as well, because there's actually research that shows that when herbs are used in conjunction with those medications, they do better than when medications are used alone.
I did want to go back to the tinnitus for 1 second. I'm treating a gentleman right now who has tinnitus and ear fullness. Like his ear sounds like he's in a
echo chamber.
Underground. What did you say?
Echo chamber.
An echo chamber, exactly. We can relate. And many symptoms in his head. And as I said, an older gentleman. He's in his mid to late 70s, I believe, and he's doing remarkably well with our care. he asked me when he was in on yesterday, that was Monday, his MD wants to know what we're doing to him. So that's always a good sign. So I welcome more questions. Irish Lassie 8686. I have a question.
We have a, do you treat it naturally with Sibo or an antibiotic? If you come to us, we will treat it naturally. If we think that you need an antibiotic, or you find that you need an antibiotic, depending on how severe it is, or your doctor thinks you do, then we will support you again with herbs in addition to the protocol to the rifaximin and xifaxan your doctor has you on. But we will use herbs first.
We use herbs first. Obviously, we want to climb the ladder of invasiveness. We want to go natural first if possible. But if someone needs antibiotics, we have the medical staff in the office to do that. Is that right?
Yeah.
We have Janelle.
Yeah, we usually just don't get to that level. It's more so people might come in.
Who can prescribe antibiotics. I have a question that people may be thinking, but no one is asking. I've been told I have IBS. Is that different from leaky gut?
Yes and no. It depends what your symptoms are again. Usually people with IBS have some level of leaky gut, but again, like leaky gut, IBS is what's happening. Like IBS, you want to find out what's causing it. IBS in itself is like you react to foods, or you react to certain situations, you're stressed, whatever it is, and you don't really know what's wrong with you. Whereas we can figure out what the triggers are for IBS, whether it's bacteria, yeast, fungi, parasites. Again, it's similar, trying to figure out why you have IBS and what's causing it. Sometimes it is just stress, but I see a lot of people that come in that are like, I've done all the stress management things, and it's beyond that.
So IBS is a symptom, and leaky gut might be a cause of that symptom.
Yes, although it's like what's causing the leaky gut too.
Yeah, no, of course. But the IBS would be secondary to the leaky gut. And of course, we need to treat the leaky gut and figure out what's causing the leaky gut. So it's good healthcare is a real detective case, right? It's very simple. Oh, you have headaches? Here are painkillers. Well, great. What does that get you when the painkillers wear off? Gets you to still have a headache. The question is, what's causing? What is the root cause of the problem, and how can we solve that? And that's our desire and our approach. By the way, even though that's our desire and our approach, it doesn't mean we can always get there. But we try to. We always try to get to the root cause of the problem so that we can solve the problem, not just cover it up with painkillers or whatever it is. Do you want to add to that, Diana?
No, that's exactly what we do.
Or is it still echoing in your ear?
No, I took it out of my ear. It was too much. Yes, and that's why we do our best to figure out what kind of testing you need. And then we'll move from there, right? We might need more testing. We might need to try some different things out with diet and lifestyle changes or supplements, right? And that's kind of like what it is. It's a process of teamwork, right? We work with us. And it's an understanding that it's unlike a pill for an ill. It's not going to be a quick fix. Some people feel pretty good pretty quick. But a lot of people, it's a longer term journey to getting to optimal health.
And that also reflects in our approach at Complete Wellness, how we do things. It's, I don't want to say rare, but usually people's health problems have multiple causes and multiple manifestations. And one of our strengths, what I like to say, is our secret sauce. What makes us really effective is our integrated approach, that we're treating people on many levels, not just with one tool. We use many tools, whether it's functional wellness, whether it's acupuncture, whether it's chiropractic for that person with tinnitus or tinnitus. Maybe it's a functional wellness approach, a functional medicine approach, plus chiropractic, plus acupuncture. Who knows? So if there are...
That's why it's called complete wellness.
That's why it's called complete wellness. It's not only how we do things, it's also the goal. People say to me all the time, what a great name. I said, yeah, that's what we're after. It was not a marketing thing. We just want people to have complete wellness. Are there any other questions? We are at time. Actually, we're a minute over, and I don't like to run over. I like to be very on time. If there are no more questions, the last thing I'm going to ask is, I think we're going to conclude. Maybe we'll dive a little bit more into the gut next week, but I'd like to move on to another topic. If there's any topic that people would like to hear about, please post that in the chat on whatever platform it is that you're watching or listening on. Feel free to join us next week, even if you don't suggest a topic. For sure, we can come up with one on our own. Thank you
And
very
feel
much.
free to direct message either Complete Wellness or me if you have questions that come up later or topics you want us to discuss after you think a little more about it.
Yeah, of course. And if you want to come in as a patient, of course, we are available and interested and would love to take care of you. If that's it, thank you, Diana. Thank you, Dio.
Thanks, everyone. Thanks, Dr. Fenster.
Yep. Have a great night, everybody.